So this is the 6th year that we've run our Industry Barometer survey, and this tests market sentiment from all of our members. And yet again, we've been kindly supported by Practicus, and we're joined here with Andrew Vaux, who is going to help me talk through the findings. One of the interesting findings of this year is members' views of the private pay market. And we've seen this trend over the 6 years that we've done the survey, and that is members are more and more positive about the private market. This year in particular, what we've seen is self-pay. Members are really positive about what's going to happen. And this has been reflected in our Going Private polling that we have done for the last few years, where we can see that the general public are just more and more likely to want to mix and match between their private and NHS care, and using self-pay as a way of doing that. So Andrew, if I can come to you on this one.
Sure.
I just wonder, what are you seeing in terms of the people that you're supporting and their view of how much they would like a private medical insurance or some kind of other plan as part of the job that they are doing?
It's actually very timely to ask that question because it's becoming more and more important. We're finding that candidates that we're placing in jobs of all levels of seniority are asking questions about PMI ultimately, and where that can't be given, perhaps with smaller and growing organisations where they're not quite set up for that yet, then we're seeing those start to offer things like cash plans more regularly, which is becoming a really important part of the makeup of what does this package entail. So yeah, really, really important. And and we're seeing more work from those that provide PMI, cash plans and medical services in terms of the work that we are doing at Practicus with them. So yeah, interesting times.
Great. Something that was new this year was providers' positivity about the role of AI and other digital technologies and the role that that can have on improving quality and safety in the workplace. And we're seeing that in other developing work. So, for example, IHPN is on the National Commission for AI, which is being run by MHRA, and that is really looking at how you embed AI and other digital technologies in the work that we do. And so I'm interested, Andrew, on whether you're seeing some kind of demand for people who have AI experience or skills or other technologies, digital technologies, maybe engineering or something like that.
Engineering is a valid point. We're seeing much more demand for engineers of all hues at all levels. I think one of the things we're also seeing is demand from existing providers in terms of training as well on AI and an understanding of AI, but also increasingly working with more fledgling organisations within that space who see an opportunity at the moment for their products and their services to improve patient care.
Thank you. So we've seen this over the last 6 years, is providers' desire to invest in their workforce, and this trend has continued again. And we're seeing that in two main ways. One is around their expectation that they're going to maintain or do even more clinical training, and the other areas around the amount of apprenticeships that they would be expected to offer. Andrew, how does this kind of tally with what you're seeing?
I mean, the apprentice side of things is still really, really important to the sector. And I think what we do see is a lot of investment within the existing skill base as well as a desire to extend that base with things like apprenticeships. So as you would hope for our sector, I would say it's a very, very important part of their strategic planning and what they're looking to do. So
Great.
Absolutely.
Great. So this year, members have found the NHS market slightly more challenging. And it's not a surprise, really, when we're aware of the budgetary constraints that the NHS is operating to. But pleasingly, with regard to integrated care systems or ICSs, an increased amount of providers actually feel that they're more part of the local system. So Andrew, what's your experience of the NHS market with the clients you're working with?
It's not without its challenges, but I think in the main, providers are still positive about wanting to work with the NHS and being part, as you said, of that integrated community. I mean, they have an opportunity to continue to support the NHS in terms of patient experience and giving patients what they need at the moment, which is the care they deserve. Yeah. So it's positive, but not without challenges, certainly. But that's probably true of most things these days.
Absolutely. So thanks again, Andrew, for supporting us with this year's Industry Barometer, another cracking survey, as we've come to expect. And also I'd like to take an opportunity to thank all our members who contributed to making this such an interesting piece of work.